Young people experience and respond to the challenges of cancer in unique ways. They also report many areas of unmet information and support needs across multiple domains of life and function. Key considerations in the care of AYA can be conceptualized as physical, psycho-emotional, social, and practical. Let's look at each of these in turn. Some areas of specific relevance to the physical well-being of young people diagnosed with cancer include sleep, fatigue, exercise, nutrition, fertility, and sexual health. Sleep problems occur in up to 60% of AYA and include problems falling or staying asleep, fragmented sleep, and excessive daytime sleepiness or napping. Poor sleep has been associated with multiple health and academic consequences, including emotional dysregulation, increased rates of anxiety and depression, and difficulties with school, study, and work. Frequent hospital admissions, treatment-related side effects, and the physical symptoms of cancer have all been shown to impact sleep, in addition to naturally occurring changes in adolescent sleep cycles due to circadian rhythm shifts and later release of melatonin. Fatigue is differentiated from sleepiness as a low-energy state that persists despite adequate rest. It is one of, if not the most prevalent and distressing symptoms reported by young people, with multidimensional physical, affective, and cognitive impacts that are unique to each individual. The range of perceptions may include a feeling of weakness and inability to perform tasks, decreased motivation and low mood, and difficulty in thinking clearly. Evidence supporting the integration of exercise as an adjunctive therapy in cancer is growing, with its benefits shown to include improvements to functional outcomes, as well as to disease-free survival and overall survival rate. Exercise is also known to mitigate some treatment-related side effects such as nausea and fatigue, and may even reverse others. Although there is limited data on exercise in relation to AYA, we know that most young people with cancer do not meet current physical activity guidelines, with studies showing that their physical activity levels often significantly decrease during treatment and do not return to pre-diagnosis levels after treatment has finished. Cancer and its treatment can affect a person's nutritional requirements, which, if not met, may have significant implications for young people in particular, given the importance of good nutrition in supporting healthy growth and development. Young people also generally have poor adherence to recommended dietary guidelines, and poor nutritional status during treatment is known to impact clinical outcomes. Good nutrition can enhance one's ability to cope with treatment, reduce the likelihood and impact of side effects, promote recovery during and post-treatment, and reduce the risk of chronic disease and cancer recurrence. Good nutrition and physical activity during treatment have also both been described by AYA as serving numerous positive physical and psychological functions. Many cancers that present in AYA and the treatments recommended have the potential to cause impaired fertility in the short and/or long term. There is clear evidence that young people are concerned about the potential impact of their cancer diagnosis and treatment on their future fertility, and wish to be provided with information and support in the early stages of their management and throughout the cancer continuum. A lack of fertility information has also been linked to reduced mental health and quality of life in young people with cancer. Conversations about sexual health are also important to young people undergoing treatment. Many AYA experience impacts to their intimate relationships, sexual desire, and function at a stage of life when one's first significant romantic and sexual relationships are forming, and normal physical, sexual, and personal identity development is still underway. Research shows that young people want sexual health information and support from their healthcare providers, but may find it difficult to initiate these discussions. Common concerns include contraception during and after cancer therapy, dealing with symptoms of premature menopause for women, dealing with symptoms of sexual dysfunction for men, and the psychological impacts of problems relating to sex and intimacy. Psycho-emotional aspects for consideration in the care of young people with cancer include body image, mental health, and emotional well-being. Adolescence and young adulthood is a critical period of identity development in which body image plays a central role. Body image may be significantly impacted by the cancer-related changes in appearance and function experienced by many AYA, such as hair loss, weight change, scarring, and limb loss. Poor body image has been associated with increased rates of anxiety, depression, and disordered eating, poorer quality of life, and decreased engagement with peers, education, and work, and can thus impact upon many aspects of a young person's life and functioning. The potential for cancer's impact on body image may even contribute to AYA treatment decisions and adherence. As with so many aspects of the health and human experience of this population, the impacts of cancer on AYA mental health and emotional well-being are intertwined with and influenced by developmental life stage factors. Young people are still developing the full spectrum of their neurocognitive and psycho-emotional capabilities and may have less mature coping responses. Cancer-related disruptions to a young person's life and development can result in significant psychological distress, which can manifest as behaviors such as avoidance, withdrawal, aggression, irritability, or problems with school or friends. The adolescent and young adult years are also when mental health problems are at their most prevalent, with 1 in 4 Australian young people aged 15 to 24 experiencing a mental disorder. While most AYA with cancer do not develop clinically significant mental health issues, the additional stressor of cancer to an already challenging life stage puts young people at increased risk for mental health problems such as post-traumatic stress disorder, anxiety, and depression, particularly in the post-treatment period. It is for these reasons and the many others discussed so far that psychosocial care for young people must be prioritized alongside their physical and clinical needs. Let's turn our attention now to the social aspects of a young person's life for consideration in the context of their cancer care and treatment, in terms of relationships, education, and employment. Cancer can significantly impact the relationships in a young person's life in both positive and negative ways. Parents or other caregivers, siblings, partners, and peers all play an important role in supporting the young person throughout their cancer journey. Providing support for and promoting well-being within these existing relationships and support networks is essential to good psychological outcomes. For example, we know that cancer in AYA significantly impacts on the broader family and siblings in particular, and the way in which the family copes with the many illness-specific stressors associated with cancer has a direct impact on the coping of the young person themselves. The peer relationships so central to the world of the developing young person can also be severely disrupted as the young person is absent from school, study, or work, too unwell or fatigued to take part in social activities, or embarrassed by changes in their physical appearance. And without appropriate support, young people are at risk of peer rejection and social isolation. Cancer in the AYA years can also delay sexual maturity by hindering development of healthy intimacy, with implications for current and future romantic and sexual relationships. It is for these reasons that young people require both a patient-centered and family-inclusive approach to care that operates in the context of the young person's social network, taking into account the needs of important people in their lives and creating opportunities for ongoing engagement with healthy peers. Young people also want opportunities to connect with other AYA patients and survivors, which is recognized in the literature as an important source of emotional support and a critical component of age-appropriate care. Study and work for young people is about so much more than formal learning or a source of income. Education and employment are important determinants of future health and quality of life, providing essential context to promote skill and identity development, self-confidence, peer relationships, and access to social activities. Both diagnosis and treatment have the potential to disrupt education and employment pathways for young people with cancer, which can have significant consequences for their future employment and career prospects, socioeconomic advantage, and mental health. They may be absent from study or work for lengthy periods, or dealing with physical, cognitive, or emotional effects that interfere with performance or reintegration in these settings. In most cases, young people can and should continue studying and possibly working alongside treatment in some capacity, with practical support and advocacy for the young person to do so recognized as an essential component of AYA supportive care. Finally, let's look at some of the practical considerations to be taken into account when planning and delivering cancer care for young people, such as their living situation, transport, and financial security. Attending to the practical needs of AYA is often prerequisite to their ability to engage in treatment and effectively process their cancer experience cognitively, emotionally, and psychologically. Having a safe and secure home environment, an appropriate mode of transport for travel to and from treatment, and financial security in relation to the costs associated with both daily living and cancer care are all important factors in supporting treatment engagement, though securing such supports often comes at developmental cost to the young person. For example, young people living independently are often forced to move back home during treatment due to their increasing care and support needs, interrupting their efforts toward greater separation from caregivers and increasing independence and autonomy. So too does any reliance young people may have on others for transport to treatment and appointments. The emotional well-being of young people whose ability to drive has been limited or halted due to their cancer can also be significantly impacted. And finally, there are the financial costs of a cancer experience, which often result in significant economic burden for young people and their families. These include the direct costs associated with cancer and its treatment, such as take-home medications, high-cost drugs, hospitalizations, and other treatment-related expenses like travel, accommodation, car parking, and food, and indirect costs, such as the loss of income for young people or caregivers due to work disruption or reduced working hours. For the emerging adult population who are in a period of transition with limited financial assets and not yet secure in their employment, the financial impacts of cancer can result in lifelong economic disparity. So, what to make of all this, which paints a pretty complex picture for the care of young people with cancer? What it really comes down to is that treatment and care for this population requires a multidisciplinary approach that takes all aspects of a young person's life and development into consideration, not only for the purpose of supporting their engagement with and optimizing outcomes of treatment, but to ensure they go on to meet their full potential as healthy members of adult society. It is also important to remember that despite the challenges they may face, young people also demonstrate remarkable resilience and adaptability and bring unique strengths and capabilities to their experience as well. Thanks for watching.